Hi, Dr. Kent here, and today I am going to have my first PRP session for androgenetic alopecia, otherwise known as male pattern baldness. And so PRP, platelet-rich plasma, is rich in platelets, which in turn is rich in growth factors that can stimulate hair growth in the areas that we desire. And what it involves is having a blood draw similar to what would be drawn from a normal lab test, processed in the lab, and then injected in the scalp for a series of 3 initiation treatments separated by 1 month. So, welcome to my journey.
Alrighty, so now that we have the blood drawn, we're going to spin the blood down. This is one of the most important steps for PRP because this separates the hemoglobin from any of the plasma. And our main goal, once we are able to separate the hemoglobin with the centrifuge, is to be able to separate the PPP, which is the platelet-poor plasma, from the PRP, which is the platelet-rich plasma, to be injected into the patients. Now that we have the centrifuge loaded, we're going to let it spin down for 10 minutes, and after 10, we'll separate and inject the patients. So it looks like the blood is done spinning, so we're going to take it out, and I'm just going to show you what it looks like and why this step is so important to the PRP. So the reason why we do the PRP in the centrifuge, and this is the most important step, is because, as you can see, it separates the hemoglobin from all the plasma. Now what I'm going to do next is draw the top maybe 2 or 3 cc's of the plasma, as that is the platelet-poor plasma that we're going to dispose of, because the bottom half is the platelet-rich plasma, and it's at the bottom because it's the heavier platelets, and when the centrifuge spins, it pulls down to the bottom. So in this step, I'm drawing out the PPP, which is the platelet-poor plasma. As you can see, I'm drawing only from the top. And before we draw the PRP, we're gonna invert it so it's a homogeneous solution. Now I have a full syringe of just PRP. We're just gonna transfer it into the smaller tubes, set them up with needles, and have them ready to be drawn and injected for the patient. We're all set, ready to bring these syringes in, and we'll inject the patient and get on with the procedure.
Now we're at the final stage, and I'm about to be injected by our team lead, Victoria, and I guess I'll tell you how it is as we go. Small poke, but definitely a real poke. Feels similar to the poke that it was to get my blood drawn, just in an area that's not as sensitive.
And that's it.
So in 1 month, I'll have another treatment. 1 more month after that, another, and then we wait 4 to 6 months after the last initiation treatment for an optional stimulatory therapy. And then if it works and it is worth it, then we continue doing it on a yearly basis for maintenance. So that is PRP.